Have you ever stopped for just a second to notice what happens when you swallow? Go ahead and do it now. Pay close attention to the back of your throat. Does it feel clear, or is there a stubborn layer of mucus that never seems to disappear? Maybe you've been clearing your throat so often that you barely notice you're doing it anymore. At first, it probably happened only when you woke up. Then it started following you through the afternoon. Before long, it became part of your daily routine. You carry a bottle of water everywhere, avoid certain foods, and you've likely tried every home remedy suggested by friends or family. Yet the problem keeps coming back. Here's what many people never realize. Your body doesn't create persistent symptoms without a reason. That constant mucus isn't simply a normal part of getting older. It's your body's way of sending an important message, and today we're going to uncover exactly what it's trying to tell you. Throughout my years working in preventive health and helping older adults stay healthier for longer, I've noticed one problem that is misunderstood more than almost any other: persistent throat mucus. Too often, people are handed throat lozenges, advised to drink more water, or told it's nothing to worry about. While those suggestions may offer temporary relief, they rarely solve the real issue hiding beneath the surface. Today, we're going to look much deeper. I'll walk you through 5 research-supported reasons why adults over the age of 55 often struggle with ongoing throat mucus. More importantly, I'll explain why 2 of these causes frequently occur together, creating a cycle that makes the problem much worse than either cause alone. By the end of this video, you'll understand not only what's happening inside your body, but also what practical steps can begin helping immediately. Before we dive in, I'd love to know something about your own experience because it reveals more than most people think. Is your throat at its worst when you first wake up, or does the mucus stay with you all day long? That simple difference provides valuable clues about what's driving the problem. Let me know in the comments whether your answer is morning or all day. I read every comment because your experiences often help others who are dealing with the same frustrating symptoms. Now let's begin with something that surprises almost everyone. Your body produces mucus every hour of every day, and that's actually a sign of good health. Mucus serves as one of your body's most important defense systems. It traps dust, bacteria, viruses, and tiny particles before they can travel deeper into your lungs. At the same time, it keeps the delicate lining of your throat and airways moist, flexible, and protected. Without this natural coating, your airways would quickly become dry, irritated, and much more vulnerable to infection. So the goal isn't to eliminate mucus altogether. The real concern is what begins to happen to that mucus as the body grows older. Scientists have identified an important cleaning system inside your airways called the mucociliary clearance system. Lining your respiratory tract are millions of microscopic hair-like structures known as cilia. Their job is remarkably simple, but incredibly important. Every second of every day, they gently sweep mucus upward so it can be swallowed or removed without you ever noticing. When we're younger, this process works smoothly and efficiently. Fresh mucus is produced, unwanted particles are trapped, and everything is cleared away almost immediately. However, aging changes this process in ways many people never hear about. Research shows that these tiny cilia gradually lose speed and efficiency over time. Instead of moving mucus quickly, they begin working more slowly, allowing mucus to remain in the throat much longer than it once did. What would have disappeared within moments at age 40 may linger for hours by the time someone reaches their mid-60s or 70s. This doesn't mean your body is failing. It's simply a normal biological change that makes every other trigger for excess mucus far more noticeable. Understanding this single fact changes the entire picture because it explains why older adults experience symptoms that younger people may barely notice. With that foundation in place, we're ready to explore the first and one of the most overlooked causes of persistent throat mucus in adults over 55, a condition that often hides in plain sight because it doesn't always produce the symptom most people expect. In the next part, you'll discover why a problem that begins in your stomach may actually be responsible for what you're constantly feeling in your throat. The reason this first cause is missed so often is because it doesn't behave the way most people expect. When people hear the words acid reflux, they immediately picture a burning feeling rising through the chest after eating a large meal. But there's another form of reflux that can quietly damage the throat without causing that classic burning sensation. Doctors call it laryngopharyngeal reflux, although many people simply know it as silent reflux. The name fits because the condition often works behind the scenes, giving you almost no warning that your stomach is involved. Instead of chest discomfort, the only clues may be a constant need to clear your throat, a hoarse voice when you wake up, or thick mucus that seems impossible to get rid of. Since there is no obvious stomach pain, many people spend months or even years treating the throat itself while the real problem continues unnoticed. To understand why this happens, picture the small muscular valve located between your stomach and your esophagus. Its job is simple but essential. After you eat, it closes tightly to keep stomach acid exactly where it belongs. Over time, however, this valve can gradually weaken. Just like an elastic band that has been stretched too many times, it may no longer seal completely. When that happens, tiny amounts of stomach acid can travel upward. In some people, the acid reaches beyond the esophagus and into the throat, the voice box, and sometimes even the nasal passages. Although these amounts may be small, the tissues inside your throat are far more delicate than those inside your stomach. They are not designed to handle acid exposure, even for a short time. Your body immediately reacts by trying to defend itself. The moment those sensitive tissues become irritated, they begin producing extra mucus as a protective coating. From a biological standpoint, this is actually a smart response. The mucus forms a barrier that helps shield the throat from additional irritation. The problem begins when this process repeats itself night after night. While you're lying flat asleep, tiny amounts of acid may continue reaching your throat without waking you. Then every morning you get out of bed with that familiar feeling that something is stuck in your throat. You clear it once, then again, and before long you've repeated the habit dozens of times without realizing the true cause. What makes silent reflux especially confusing is that many people never experience heartburn at all. Clinical studies published by ear, nose, and throat specialists have shown that a large percentage of patients with this condition report no burning chest pain whatsoever. Instead, they describe waking up with a rough voice, frequent throat clearing, a sensation of something lodged in the throat, and mucus that starts building almost immediately after getting out of bed. That's why it's worth asking yourself a few simple questions. Is your throat noticeably worse first thing in the morning? Does your voice sound deeper or raspier when you wake up? Do your symptoms become more noticeable after bending over or lying down? If you answered yes to several of those questions, silent reflux could be playing a much bigger role than you realize. There is another important piece of the puzzle that many people overlook. If you regularly take anti-inflammatory medications for arthritis, back pain, or aching joints, those medicines may be contributing as well. Drugs such as ibuprofen and naproxen are effective for reducing pain, but research has shown that frequent use can weaken the stomach's natural protective lining. As a result, acid reflux, including the silent form, may become more likely or more severe. That doesn't mean you should suddenly stop taking prescribed medication, but it does mean the connection deserves a conversation with your healthcare provider. Sometimes a simple adjustment in treatment can reduce irritation without sacrificing pain control. Now let's move to the second major cause, one that often develops so gradually that people mistake it for a normal part of aging. When most people think about sinus problems, they imagine severe facial pressure, pounding headaches, or a completely blocked nose. But chronic sinus inflammation in adults over 55 often looks nothing like that. Breathing may seem perfectly normal. There may be little or no pain. Yet the sinuses continue producing just enough extra mucus for it to slowly drain down the back of the throat throughout the day. This condition, known as postnasal drip, affects countless older adults, and in the next section, you'll discover why many common treatments fail and what research shows actually works. Postnasal drip can be incredibly frustrating because it rarely announces itself with dramatic symptoms. Instead, it quietly works in the background. The lining inside your sinuses becomes mildly inflamed, producing just a little more mucus than usual. Rather than flowing out through your nose, that mucus slowly travels down the back of your throat hour after hour. Since the process is gradual, many people don't even realize it's happening. They simply notice themselves swallowing more often, constantly clearing their throat, or feeling as though something is stuck there that refuses to disappear. Recent research has shown that adults around the age of 55 and older make up the largest group of people diagnosed with chronic postnasal drip, proving that this isn't just coincidence. It's a condition that becomes increasingly common as we age. Many people automatically assume allergies are to blame and begin taking over-the-counter antihistamines. While those medications certainly have their place, they often fail to solve this particular problem. That's because antihistamines mainly dry out mucus rather than reducing the inflammation inside the sinuses that's causing the excess mucus in the first place. In fact, drying the mucus too much can actually make things worse. Thick, sticky mucus is much harder for your body to clear than thinner mucus, especially when your natural airway cleaning system has already slowed with age. Instead of feeling relief, many people end up with mucus that feels even heavier and more difficult to remove. Research points toward a surprisingly simple approach that has consistently produced positive results: regular saline nasal irrigation. Using a warm saltwater rinse helps flush away accumulated mucus, reduce swelling inside the nasal passages, and improve the movement of those tiny cilia we discussed earlier. Clinical reviews published in recent years have found this method to be both safe and effective for many upper respiratory conditions. The key, however, isn't doing it once whenever symptoms become unbearable. Consistency is what produces lasting improvement. A single rinse may provide temporary comfort for a day, but making it part of your daily routine allows your airways to function more naturally over time. Later in this video, I'll explain exactly how to perform it correctly so you receive the greatest benefit. Now let's move to the third cause. And this one often catches people completely by surprise because the source of the irritation isn't an illness at all. It's a medication they trust to improve their health. Specifically, we're talking about a group of blood pressure medications called ACE inhibitors. These medicines have helped millions of people control hypertension and lower their risk of heart disease. They are widely prescribed because they work well and are considered safe for most patients. Yet, like every medication, they can produce side effects, and one of the most well documented is persistent throat irritation accompanied by an ongoing urge to clear the throat. The reason this happens has nothing to do with an allergic reaction. Instead, ACE inhibitors allow a naturally occurring substance called bradykinin to build up in the body. For some individuals, especially older adults, that increase irritates the tissues lining the throat. As a result, they experience frequent coughing, throat clearing, or the sensation that mucus is constantly collecting in the back of the throat. Studies estimate that somewhere between 5 and 20% of people taking these medications develop this side effect, making it far more common than many patients realize. What makes the situation especially confusing is that the symptoms don't always appear immediately. You might begin taking a blood pressure medication today and feel perfectly fine for several weeks or even months. Then, long after you've forgotten about starting the prescription, the throat irritation slowly begins. Because the timing is so delayed, most people never suspect the medication could be responsible. They blame seasonal allergies, changing weather, or simply getting older. Meanwhile, the real explanation continues unnoticed. Large clinical studies involving tens of thousands of patients have found that adults over the age of 65 are significantly more likely to experience this side effect than younger users. That makes this information especially important if you're watching this video. If you currently take medication for high blood pressure but aren't sure whether it's an ACE inhibitor, your pharmacist can identify it in just a few moments. Even more importantly, there are other classes of blood pressure medications, such as angiotensin receptor blockers, often called ARBs, that provide excellent blood pressure control without causing this particular throat problem. Of course, you should never stop or change a prescribed medication on your own, but having this discussion with your doctor could make a meaningful difference if persistent throat mucus has become part of your daily life. So far, we've uncovered 3 major causes that often hide in plain sight. But the next reason may be the most underestimated of all, because it involves something so ordinary that most people rarely give it a second thought. Yet this simple everyday habit directly changes the thickness of your mucus, affects how easily your throat can clear itself, and quietly influences every other cause we've discussed. In the final part, we'll explore why hydration is far more complex than simply drinking a glass of water, reveal the surprising connection between your gut and your respiratory system, explain why 2 of these causes often work together, and finish with practical, research-backed steps you can begin using tonight, followed by the most important takeaway that could finally help you break the cycle of constant throat mucus for good. Hydration may sound too simple to deserve much attention, but once you understand what happens inside your body, you'll realize why it plays such a powerful role in persistent throat mucus. The mucus coating your airways is made mostly of water. When your body has enough fluids, that mucus stays thin, slippery, and easy for the tiny cilia in your airways to move upward and clear away. But when your body is even mildly dehydrated, the mucus becomes thicker, stickier, and much harder to remove. Imagine pouring fresh maple syrup compared to syrup that's been sitting uncovered for hours. It's still the same substance, yet it behaves completely differently. Your mucus responds in much the same way. The challenge is that aging changes your body's ability to recognize thirst. Research has consistently shown that as we get older, the thirst signal becomes much weaker. That means you can already be mildly dehydrated without ever feeling thirsty enough to reach for a glass of water. If you wait until thirst reminds you to drink, you're often already behind. Day after day, that mild dehydration keeps mucus thick, allowing it to cling to the back of the throat and making every other condition we've discussed even more noticeable. That's why experts often recommend maintaining steady fluid intake throughout the day instead of drinking large amounts all at once. Water is an excellent choice, but herbal teas, broth-based soups, and foods naturally rich in water also contribute to your daily hydration. The goal isn't simply drinking more, it's staying consistently hydrated from morning until bedtime. Now let's look at the fifth and perhaps most surprising cause, because it doesn't begin in your throat, your nose, or even your stomach. It starts much deeper inside your body, within your digestive system. Over the past several years, scientists have discovered an important connection known as the gut-lung axis. This refers to the close relationship between the trillions of beneficial bacteria living in your intestines and the health of your respiratory system. These microorganisms don't simply help digest food. They also communicate with your immune system, influencing inflammation throughout the body. When the balance of healthy bacteria becomes disrupted, a condition known as dysbiosis, the immune system may become overactive. Instead of responding only to genuine threats, it can begin creating unnecessary inflammation, including inside the airways. As a result, your throat and respiratory passages may produce extra mucus, even though nothing is directly wrong with them. Multiple peer-reviewed studies published in respected respiratory and immunology journals have demonstrated that disturbances in the gut microbiome can increase airway inflammation and encourage excess mucus production. Laboratory studies have supported these findings as well, showing that changes inside the digestive tract can directly influence immune responses in the lungs and upper airways. Although research in this field continues to grow, the evidence is becoming increasingly convincing that caring for gut health may also benefit breathing, throat comfort, and mucus regulation. Now let's put all 5 causes together, because this is where everything begins to make sense. In many older adults, persistent throat mucus doesn't have a single explanation. Instead, several of these factors quietly overlap. Perhaps aging has slowed your natural mucus clearing system. Mild dehydration makes that mucus thicker than normal. Silent reflux irritates the throat while you sleep, triggering even more protective mucus. At the same time, chronic postnasal drip adds a steady stream of mucus from above. If you're taking an ACE inhibitor, the medication may further irritate your throat, while an unhealthy gut microbiome quietly increases inflammation in the background. Individually, each problem may seem manageable. Combined, they create the constant cycle so many people struggle with every single day. That's why treating only one symptom often leads to disappointment. Lasting improvement usually comes from identifying which combination of causes is affecting you and addressing them together instead of focusing on only one. The encouraging news is that there are practical steps you can begin today. If your symptoms are worse in the morning, discuss the possibility of silent reflux with your healthcare provider, and consider avoiding heavy meals close to bedtime while slightly elevating the head of your bed. If postnasal drip seems likely, make daily saline nasal rinsing part of your routine instead of using it only occasionally. Review your medications with your doctor or pharmacist to determine whether an ACE inhibitor could be contributing to your symptoms, and never change prescriptions without professional guidance. Stay consistently hydrated throughout the day rather than relying on thirst alone, and support your gut by eating a balanced diet rich in fiber and fermented foods whenever appropriate for your health needs. These simple changes may not produce overnight miracles, but together they can significantly reduce the irritation that keeps your body trapped in the cycle of constant mucus production. Most importantly, remember this: persistent throat mucus is not something you should simply accept as an unavoidable part of getting older. Your body is communicating with you, and when you understand the message, you can finally begin responding in ways that address the real causes instead of temporarily masking the symptoms. If today's video helped you better understand what's happening inside your body, don't keep this information to yourself. Give this video a thumbs up, subscribe to the channel for more evidence-based health advice designed specifically for adults over 55, and share it with someone who is constantly clearing their throat but still doesn't know why. Thank you for watching, and I'll see you in the next video. These small habits may seem insignificant, but they can greatly reduce the chance of falling. Even so, if dizziness continues beyond the first few weeks after starting a medication, happens frequently, or is severe enough that you almost faint, it deserves a careful discussion with your doctor. Sometimes the medication dose needs adjustment. Sometimes the combination of medications should be reviewed. In other cases, improving hydration or changing daily habits may solve the problem. Whatever the cause, staying silent is never the best option. And speaking of things that cause unnecessary worry, there is another misunderstanding that leads countless people to make dangerous decisions about their blood pressure medication without realizing it. One of the biggest mistakes people make when managing high blood pressure at home is believing that every single reading tells the whole story. It doesn't. Blood pressure is constantly changing throughout the day. It rises and falls naturally in response to dozens of factors, many of which have nothing to do with whether your medication is working. Think about everything that can influence a single reading. Did you sleep well the night before? Have you had coffee this morning? Are you feeling anxious? Did you just climb a flight of stairs? Are you dealing with pain from arthritis or a headache? Did you rush to sit down before checking your blood pressure? Even talking while the cuff is inflating can affect the result. This is why one high reading does not automatically mean your medication has stopped working.